Welcome to Community Health Matters. I'm your host, Kristin. Taking steps to prevent falls, identifying suicidal tendencies in friends or loved ones, healthy aging, and infant mortality. September brings health observances for each of these four important issues that are all the focus of our show today. Joining us are Terry Love with the Tennessee Department of Health, Samantha Nadler of the Tennessee Suicide Prevention Network, Jim Shulman of the Tennessee Department on Aging and Disability, and D'Yuanna Allen-Robb of the Metro Health Department. All of that coming up next on Community Health Matters. If you take care of a loved one and they happen to be a senior citizen, one of the primary concerns you probably have is to make sure that they do not take a fall in your home or their home. Naturally, for a lot of us, we want the best for a loved one. And we're talking about that today, fall prevention. We're going to be doing that with Mr. Terry Love. He is the Injury Prevention Manager with the Tennessee Department of Health. So nice to have you here today, Terry.
Thanks for having me.
For folks who don't know, Falls Prevention Day actually happens on the first day of fall this year, and this is going to be the 8th annual Falls Awareness Day. Tell us the importance of it.
Falls Prevention Day is the beginning, or the start of awareness for seniors and everyone around falls in the home. And this is an event that has been coordinated by the National Council on Aging for 8 years. And it's one of many fall prevention activities we do here in Tennessee.
Yeah. Something that folks might not know, every 13 seconds, a senior citizen is actually treated in the ER because of a fall. This is kind of a alarming statistic. When you think about 13 seconds, you might think every 13 minutes, but there's even more statistics that you can share with us that people need to consider.
National statistics show about 1 of 3 adults over 65 fall each year. And many of us fall.
Sure.
All age groups fall, but those older adults are most at risk for falls. There are hundreds of emergency room visits in Tennessee, and there are actually fatalities due to falls. In 2012, I think we had 500 fatalities due to falls, which is the most tragic thing that can happen as a result of a fall.
Sure. Do you all look at aging as the primary reason why people do fall? I mean, is it a lack of balance or mobility that they start to
Well, as we age, our body changes, and we tend to get more sedentary as we age, and that is a major risk factor for falls. If adults are not exercising, doing weight-bearing exercising, balance exercises, they put themselves more at risk for falls. And then one of the kind of a snowball effect, if a senior has a fall, then they become afraid to do activities, and that makes them more sedentary. They move less, and they're more likely to fall. Or they may not be willing to talk to their healthcare provider when they fall because they're afraid if they tell someone, they might lose some independence. And this is actually counterintuitive. I would urge people to talk to your healthcare provider, even if you haven't fallen. Ask your health care provider for a medication review. Go to the eye doctor, have your glasses checked. Clean your glasses. These are all things that seniors can do to help create conditions where they are less likely to fall.
Great information and great advice, actually. If you are taking care of a loved one, sometimes that's a hard conversation to have.
Sure.
What do you suggest, Terry, of how people go about having that conversation or starting it with their loved one about falls?
Well, I would say be open and honest. And explain to them that you care about them and that this is a serious issue. And chances are, if they're over 65, they've already fallen. And so they are probably open to discussion, more open than you think.
Sure.
And anything that you can do to help them get the resources to manage falls would be also helpful.
All right. You talked about seniors possibly getting their eyes examined, making sure that that's okay, or cleaning their glasses, things like that. What are some other things they should be thinking about when we're talking about prevention, fall prevention?
Well, the first thing is to declutter the home, light the home, using night lights, grab bars, getting that favorite rug that you got for Christmas 10 years ago and putting it out of the way because it's a fall hazard. Being mindful of pets. Pets are a big risk for falls. Also, sweeping leaves away from sidewalks. Wet leaves equal ice. They're very slick. minor home repairs that that you've neglected over the years, a sidewalk crack here, a light out in a closet, those kind of things are very important for seniors to focus on.
Yeah, and obviously, again, if you are taking care of somebody, going into that home and kind of assessing it is
Sure.
probably a good idea.
And people can contact us. They can email me at terrence.love@tn.gov. I'd be glad to forward them documents, files that would show them how to do a quick home assessment for safety. Or they can call at 615-532-7778. I'd be glad to visit with someone. There are multiple resources in their senior centers, in their doctor's offices, the YMCA. I would encourage folks to reach out and do prevention in their own homes.
All right. Obviously, the state of Tennessee is doing what they can to raise awareness, you know, both the personal and the financial tolls of falls. But what else is the state doing, I guess, to promote fall awareness?
Well, we actually have fall prevention classes that seniors can take. We trained 38 Stepping On leaders. Stepping On is a evidence-based fall prevention program. It's a 7-session program that's held typically in a senior center or a community center. It's in groups of seniors. It's story-based. We have experts come in. We do very simple exercises for seniors. These are for seniors who are still living independently, and I would love to speak with someone if they're interested in hosting a Stepping On class with our trained leaders, or receiving training if they want to become a leader, or if they are interested just in attending the classes.
So obviously September is a great time to,
Sure.
to make people aware of falls prevention, but at the same time, this is year-round awareness.
Yeah, prevention is like brushing your teeth. You do it every day, all year long, and if you're really good, you floss. And so, you know, awareness, prevention is not accomplished with one event, but that sometimes sparks people to make a change.
Sure.
So that's why we really support the Falls Prevention Day on September 23rd, and then we would love to connect with folks and then encourage them to join our other programs.
Okay, and Terry, if there's one important thing that you would get out to folks who are watching this, what would you say would be the most important thing, a takeaway, if you will?
If they think they have an issue with falls, talk to their healthcare provider. That's a great start. That would be probably the biggest piece of advice I would ask them to do.
All right, Terry Love with the Tennessee Department of Health. Thank you so much for your time today. We
Thank
really
you.
appreciate it. Great information. Welcome back, everybody. We are talking about suicide. It may be a very difficult and challenging conversation to have, but it is extremely important. How do you prevent it? By talking about it, and we're going to do that today. And I welcome to the program Samantha Nadler. She is the Middle Tennessee Regional Coordinator for the Tennessee Suicide Prevention Network. Thanks so much for being here, Samantha.
Thank you for having us.
Let's talk, first of all, the month of September, you all have a lot going on. Kind of explain some of the events and some of the different things that are going to be going on that you want to make people aware of.
Sure. So September is Suicide Prevention Awareness Month in the state of Tennessee. We have governors and mayors all across the state sign off on proclamations saying that this month is Suicide Prevention Awareness in our state. And so we have events all across that highlight the need for stories of recovery and resiliency, so that way people can know that there is hope. Our big statewide event is on September 9th at Trevecca University. We also have 2 local events in Nashville, one on September 10th, and that is the You Matter Yellow Gala, and then on September 17th, we have our Mid-Cumberland Regional event at Sevier Park.
Terrific. How preventable, not preventable, I should say how prevalent, first of all, is suicide here in the state of Tennessee, if you can share some statistics?
Sure, it's unfortunately very prevalent. It's the 9th leading cause of death for our state, and in 2013 we lost over 1,000 people to suicide, which is the highest we've seen it. So we lose a lot of people. In fact, it's 3 a day. We lose 3 Tennesseans a day to suicide.
And we will talk about the prevention of it, of course, but let's talk also about age range. I mean, does suicide even have an age attached to it?
Well, suicide does impact all age groups, but the way it impacts can be different. So it's the 2nd leading cause of death for our youth. So we see it very prevalent in teenagers and young adults. But where we see the highest rate of suicide is for our middle-aged individuals, specifically white middle-aged men have a very high rate of suicide.
And Samantha, I know that you have a very close connection and experience yourself. If you don't mind sharing that with us, please.
Sure. I'm a suicide attempt survivor, so that means I've survived my own suicide attempts. I started attempting suicide when I was 12, and my last attempt was when I was 19, so I have about 8 or 9 in total between that time. And so I really struggled with anxiety and trauma that was not being addressed, and that led me to feeling pretty hopeless and like things weren't going to get better. And also when you're a teenager, you have no ability to see things in the long term because that part of your brain isn't even fully developed yet. So it's very easy to think that this is how it's always going to be, and I truly believe that. So I really struggled during that time getting through that, but haven't attempted since then, so it's been quite some time.
Can you share with us a little bit too about how you overcame
Sure.
the feelings that you had that kind of led you down that path to begin with?
Yeah, well, I started volunteering at the crisis line here in Nashville about a year after my last attempt. And I did that partially because I was going into mental health anyway and I wanted to get some experience, but I also wanted to see if I was able to do this kind of work because I had my own experience. It's very taboo to be in the mental health field and have your own problems. You're not supposed to really talk about that, so I wasn't sure if there were other people like me. So being around other people who worked in that setting, who fell into that line of work because they had their own lived experience, was really helpful for me. And also just talking about it, removing that shame and that stigma and being able to own it and not feel like that's something you shouldn't share because your competency would be judged or your ability. And so I really got a lot of help from that. And also just taking the time to understand my mental health issues made a huge difference too.
You know, you pointed out you were younger, obviously, during your attempts, and I think, so many young kids are so impressionable and have a hard time adjusting and coping with things. Now that you're on the other side of things and you have been able to help so many people, how do you, how do you feel about the work that you've been able to do? And what is a big message from you personally to teenagers? What would you say to your younger self? Maybe I should say that in a better way.
Well, that's a good question. I would say that things do change and the way you feel about things changes. I remember telling my therapist I'm not going to live to see the age of 18, and I really believe that. And things are so different than what I would have expected them to be, and unusually so. I had a lot of life circumstances that changed things from when I was struggling to now, but I never would have thought that I would be here teaching about the very thing that I struggled with. And I think if I had known that that was even a possibility for me, that would have changed things. So just knowing that things will change and the way you look at things will change and how you perceive it all can make a really big difference, especially as time moves away from those events.
Sure. Maybe, Samantha, you're the best person too to ask. When you have somebody in your life that you feel maybe lonely or hopeless or having even some of the same feelings that you described, how do you go about trying to help them? And maybe what I should ask first, we'll get to that in a second, what are you looking for specifically in somebody who might be hurting?
Someone who is thinking about suicide can display a variety of warning signs. Some of them are really concrete, whether that's explicitly saying they want to kill themselves or writing out a suicide note or getting access to the means to take their life. So those are really pretty concrete and clear. Then there are other signs like isolation and hopelessness and moodiness and things of that nature, even, unexplained irritability or anger. And it comes across as anger, but really that's someone who was hurting, and that's how they show it.
Sure.
So a lot of things like that. I mean, people who are struggling with depression, even anxiety. I mean, those are symptoms that could really make suicide an option.
Yeah, so when you have a close friend or even a relative who's experiencing some of these things, what's the best way to kind of have a conversation with them, or what's the first step you should take as somebody who wants to help?
Ask them. Ask them if they're thinking about suicide, and you need to do it in a very clear and direct way. A lot of people, when they're asking about this, they might be vague and say, are you thinking of harming yourself, or do you think of not being here anymore? And that could be very different than suicide. When you use the concrete language, it shows that you're not afraid to talk about it and that we're discussing suicide. That is what I'm asking about. So it's pretty clear cut, and a lot of people feel like, well, if someone was really suicidal, wouldn't they just say it? But because of the stigma and the shame and judgment that comes around suicide and mental health issues, it's really hard to reach out when you don't know what kind of response you're going to get. even from a mental health professional. You know, a lot of people are afraid that the cops will be called on them. So just asking directly, because you're giving that person permission to share with you then.
Sure. And obviously I should point out too, for folks who don't have a loved one or a friend to turn to, obviously the crisis hotline is another excellent way to go ahead and try to reach out to somebody. Samantha Nadler with the Tennessee Suicide Prevention Network, thank you so much for your time, and thank you especially for sharing your personal story. We appreciate it. How do you keep a sharp mind as you age, or just a healthy brain for that matter? We're going to be talking about that topic now, and we welcome to the show Jim Shulman, who's the Executive Director over at the Tennessee Commission on Aging and Disability. It's always so nice to see you.
Thank you.
Hope
Thank you for having me.
well.
Been doing well.
You know, I know September's an important month because it's obviously the Healthy Aging Month. Talk a little bit about what the Commission does in terms of trying to reach out to folks and educate them.
And part of the responsibility of the Commission is to reach out and talk to folks who are getting older, and try to figure out better ways to communicate and educate people about healthy aging.
Sure.
You know, what do you need to do? You know, everybody wants to get older and live a much healthier lifestyle and live to be, you know, to a ripe old age.
Yes.
So the question is, how do you do that? How do you, what kind of information can we convey to people so that they understand what they should be doing?
Absolutely.
And that's what the Commission does.
And you know, it is our responsibility. It's also our responsibility for family members and loved ones as we see them age, to kind of help them navigate life and make good choices when they're older.
Sure.
What are some of the lifestyle choices, Jim, you would tell folks as they age to kind of to go about the way of life they should lead?
Well, you know, healthy aging doesn't begin at 65. I mean, it really begins at 25.
That's right.
So what do you need to do, you know, to be healthier as you get older? You know, eat well, exercise, don't smoke, exercise your mind, you know, learn new things, stay socially interactive, you know, have friends, go out and do stuff, and go to the doctor. You know, make sure that you're listening, you're trying to stay healthy. I mean, get checkups, do those things that you're supposed to do.
Sure. So many people devote their life to a certain career. They may retire, and they may think to themselves, well, now what do I do? Some people travel, some people actually try to go take college courses. I've seen some seniors doing things like that.
Yeah.
Good idea, obviously, to try to maybe learn some new things or educate yourself all over again.
So think about it. I mean, you know, you get to be 65, 70, even older than that, and you retire, and then you're going to go, what am I going to do? A lot of people start planning about what they're going to do, you know, way before they retire.
Sure.
You know, it's like a whole new life.
I know.
What do you want to do? You know, used to be that people would go, I'm going to go travel. Well, that's great. But a lot of people start volunteering. A lot of people enter a whole new career. What is it that you always wanted to do that you never had the chance to do before? And so they, you know, they pick up a whole new lifestyle. We find, you know, touring the state, that if you, the people who seem to be doing better as they get older are those people that have a purpose. You know, there is something that they want to do, something that gets them up in the morning and drives them.
Yes.
And it may be driving people, you know, it may be driving older Tennesseans around.
That's
but
right.
it's something that gets them up, and they really seem to do much better when they really have a purpose.
So would you say it's almost kind of stimulating your mind and making sure that you maintain some sort of passion in life? I mean, we all are going to be passionate about our family, but at the same time, when you let go of that career or that job or that whatever you did every day, you have to kind of almost reinvent yourself, no matter your age.
Well, you can call it reinventing, you can do it, whatever you want to do, but I think the idea is really, you know, what is it that's going to keep you moving ahead?
Sure.
And there are so many opportunities. I mean, it's interesting to go to, you know, what we call senior centers and see people calling other folks that are in their house and can't get out, just to make sure they're okay. It gives everybody a sense of purpose. You know, driving, like I said, driving seniors to the doctor, driving them to a pharmacy, driving them to a grocery store, a whole purpose going on. It's amazing. You know, when you go around and talk to people, and they're doing all kinds of wonderful things. I mean, life doesn't stop at 65 or 70. It just keeps on going. And the idea is, what do you want to do, and go do it.
Those things that you mentioned, do those kind of keep us from maybe experiencing things like dementia, or even, you know, certain kind of things that you would contribute to an Alzheimer's disease or dementia?
You know, right now there is no way to, there's no known way to prevent.
Stave off,
to stave it off. But there are some things that you can do that recent studies have shown, and that is you got to stay healthy. okay? Diabetes, health disease, you know, those are risk factors in terms of Alzheimer's. So what do you need to do? You need to stay healthy, eat better, exercise, you know, learn new things. You got to keep going.
Absolutely.
But stay healthy. I mean, obviously everybody wishes there was an answer to stave off Alzheimer's, stave off dementia.
Yeah.
And I know that there are a lot of people working very, very hard to try to figure this thing out. And you're learning new things all the time. I mean, we get new information all the time. But until that day comes, I mean, there's a lot of people who are getting it, and it's very, very scary. And so, you know, the way I look at it is if you can figure out a way to stave it off, if eating better and exercising is one of those things, or two of those things that you need to do, then do them.
Sure.
Yeah, I think it's very important.
Let's talk specifically too, Jim, about how much exercise you would tell folks to get, you know, when you're aging, and because you want to be responsible and careful too in how you go about
That's
exercising, but then also your diet, what it should consist of. People don't want to be eating bland foods. You know, that was one of the biggest criticisms I think a lot of people have, is they have to usher into assisted living. They don't want that. They still want a little bit of kick in whatever they're consuming.
Look, I mean, it's the same thing, and we all go through. I mean, you want to eat right. I mean, every so often maybe it's okay to not have bland food. I mean, you want to eat healthy, and you want to do that. I mean, you want to live a healthy lifestyle, but it doesn't mean that you have to turn everything away.
Sure.
Does that make sense?
Yes, absolutely.
Okay.
And as far as physical activity,
Physical
are they going
activity
out several times a week?
Yeah, I think if you exercised, you know, like 30 minutes, 5 days a week, and what you want to do is you want to get your heart rate up a little bit. You want to sweat a little bit.
Sure.
So it's always probably a good thing to check with your doctor before you do any of this stuff.
Absolutely.
But assuming that everything's okay, a brisk walk is something that's pretty good.
All right.
So that's one way to do it.
And talking about healthy diet, one little morsel that you could tell folks that's especially important, what should they take away from today?
You know, it's okay every so often to you know, expand your diet, but eat healthy. I mean, that's one of the things that you really want to do.
All right. Jim Shulman from the Tennessee Commission on Aging and Disability. So nice to see you.
Nice to see you.
Thanks for visiting with us
Thank you.
today. Appreciate it. We've talked about different kind of medical issues that are a little bit more challenging to discuss, and we're going to talk about something like that again, infant mortality. But it's very important information, and I think all new moms, and if you're considering on having a child, this is part of the program that you definitely need to tune in for. We want to welcome D'Yuanna Allen-Robb, who's the Director of Fetal Infant Mortality Review over at Metro Health Department. Thank you so much for being here today. As I mentioned, this is not always the easiest of topics to talk about, but so important to get out really good information to folks out there. We know the Metro Health Department has done a terrific job in doing so. You all have your baby shower. We were talking about that before this segment started, and the great work that you do over there. But talk a little bit about the scope of the issue here in Tennessee.
Sure. Well, infant mortality is defined as the death of a baby before he or she gets a chance to turn a year old. And unfortunately, while we've made great strides in ensuring that our babies are born healthy in Tennessee and in Nashville, we still rank pretty close to the bottom in terms of the 50 states. It's almost better to be born anywhere else in the United States than it is to be born in Tennessee, and that's unacceptable.
Yeah.
At the same time, we also know that for babies that are born healthy, not all of our moms fare the same. We know that African American women and other women of color sometimes experience rates of deaths of their babies more often than other moms do. And we have programs in place like the Fetal Infant Mortality Review, and we do a lot of community outreach and engagement. We've made strides, and there's still more to do.
All right, but we have made some progress. I know you mentioned that, touched on that a little bit, but compared to a couple of years ago even, I think that, you know, we have done a lot better. And obviously you would agree. Talk a little bit, though, about that as well.
Sure. At about 10 years ago, our infant mortality rate was about 11.6% or so. That we look at the number of infants that die in comparison to the number of all babies that are born alive. And over the last 10 years, we've seen a pretty steady decline in the overall rate of infant death, which again is a great mark for us as a state and us as a city here in Nashville.
Sure.
But we also know that those health disparities still exist, that rate of decline hasn't been the same when we start to look at individual cases of death as well as kind of subgroups along racial and ethnic lines.
All right, let's talk about now the cause, and that is, again, the hard thing that you have to discuss, but the very important information that parents need to hear. So what is the cause behind the infant mortality right here in Tennessee?
It's pretty complex, right? So actually the leading cause of death of babies, at least in Nashville, are really babies that are born premature. And those are the babies that are born too soon, so the mom doesn't get to carry the baby all the way to 9 months or to 38 weeks gestation. And those babies that are born too soon are oftentimes born at a very low birth weight. Unfortunately, for many of our women in Tennessee, we're pretty healthy, but we could all stand to lose a little bit of weight. We have chronic health conditions that we need to manage. And so we have a lot of women that just are not healthy before they become pregnant, and they bring those kind of unhealthy medical conditions into the pregnancy, and they are exasperated by the pregnancy. So addressing the prematurity issue is pretty complex. For the babies that are born healthy, the infants that get to celebrate and come home from the hospital. What is unfortunate, though, is about 1 in 4 of those babies that we see who die. They die because they're not placed to sleep in a safe sleep environment. And we know that for those babies, their death, in the most cases, is 100% preventable.
Yeah, and it is the safe sleeping and the ABCs of sleep. Let's talk a little bit more specifically about that, because when new parents are getting ready to bring home their baby, a lot of them want to co-sleep. A lot of parents want to have that new baby right there in case they need anything. They can be very close to them.
Sure.
Tell us exactly how a baby is to properly sleep at night.
Sure. The American Academy of Pediatrics developed a set of recommendations that are adopted both by our Tennessee State Department of Health and locally here in Nashville, and certainly we adopt those in the information that we share in parents. The Safe Sleep campaign really started as a result of those recommendations, and we call it the ABCs of safe sleep. So what we want parents to know is that we want all babies to be placed to sleep on their back, not on their stomach, not on their side. Back is the safest way for them to sleep at nighttime and during nap time. We want all babies to be placed in a crib. They need to have their own bed, not in the bed with an adult or another sibling, or we see these really cute pictures on Facebook of babies cuddled up with animals on the couch. They're cute, but they're potentially deadly. And finally, we want babies, when they are asleep in their crib, to sleep without anything else in there. No blankets, no stuffed animals, no toys, no bumper pads. If parents are concerned about their baby being cold, there are wonderful onesies, and there's also a really great product called a sleep sack that we encourage parents to purchase, that they can kind of zip the baby in, and it ensures that nothing gets near the baby's face while he or she is asleep.
Yes. What about that great motherly advice that you might get? Things were done so differently back in the day. Things have changed, but for reasons, obviously.
Yes.
So when you have that parent who's wanting so badly to help you and just say, just let the baby sleep this way, how would you be able to, talk with that parent, that loved one who wants to be able to help?
Well, sure. And as you mentioned, one of the most common reasons why parents, new parents especially, want their babies close and might bed share is for that reason, right? They want their babies close, they want a bond. We know that that's important for brain development and healthy child development.
Sure.
We do encourage room sharing. Room sharing is different from bed sharing in that the baby can be in his or her own crib in the same room with you. There's lots of great products out there where the baby can be placed very close to the parent's bed. Mom can still nurse if she chooses to. Dad can still get up and take care of those late night diaper changes. But we know our parents' generation, or even the generation before, had babies that died and nobody really understood why. We've had advances in our medical knowledge and in our public health knowledge that really helps us understand that a lot of those deaths really could have been prevented if babies were properly placed to sleep. We encourage parents not to take the risk of just that one time, because that one time might be the one time that baby stops breathing.
So well said. D'Yuanna Allen-Robb from Metro Health Department, thank you so much for your time today.
Thank you.
And thank you all for watching Community Health Matters.